Henson. Our top stories today: mental health and COVID, what you need to know to protect your mental health during the pandemic. Also, it's flu season, so we'll have some tips about flu versus COVID. And sexually transmitted infections, we'll have some prevention and education tips. Plus, sports and weather later in the broadcast. First up, October is Mental Health Awareness Month, and the COVID pandemic has had a negative impact on many parts of our community. Our ADN team of Charlene, Danielle, and Madison have some helpful information about treatment and support.
Thank you, Hart. During the COVID pandemic, mental health has been a real issue. The stress and anxiety associated with factors concerning COVID-19 have increased depression, anxiety, stress, and substance abuse among many. Loneliness and isolation have certainly played a role. Fear and sleep pattern changes can affect one's mental well-being. COVID has been one of the most terrifying things to happen. It's cost us our loved ones, holidays spent with family, and overall stress and anxiety. In a poll conducted in mid-July, 53% of adults that already had a mental illness said that COVID-19 had negatively impacted them in some way. According to the CDC, young adults, racial ethnic minorities, essential workers, and unpaid adult caregivers reported worse mental health outcomes, increased substance abuse, and elevated suicidal ideation since COVID-19 began. Symptoms of anxiety disorder and depressive disorder are significantly higher in 2020 than in 2019. A survey revealed that adults 18 and older had a 40.9% increase in adverse effects from mental health illnesses. Behavioral health, such as anxiety and depression, was up 30.9%. Trauma and stress-related disorders is up 26.3%. Substance abuse related to coping with stress is up 13.3% compared to 2019. 10.9% of respondents reported being suicidal in the last 30 days before the survey. Suicidal ideation was much higher in 18 to 24-year-olds and more prevalent in males than females. Trauma, stress disorder, increased substance abuse use, suicidal ideation were prevalent among essential workers more than non-essential workers. However, there are many ways to help cope, such as deep breathing and meditation. Eating a well-balanced diet can help improve your mental health. Getting enough sleep and exercising, avoiding tobacco, alcohol, and drugs. Also, limit screen time and try to relax. Keep a routine, limit stress about COVID-19. Try to stay busy and focus on things that are positive. If you have a moral compass or a spiritual life support, you can use that. Set priorities, connect with others via FaceTime and Skype. Do something for others or support a family member or a friend. Also, other support is available, such as the Suicide Prevention Lifeline, and that number is 1-800-273-8255. Again, the number to Suicide Prevention Lifeline is 1-800-273-8255, and they are available 24 hours a day, 7 days a week. You are not alone. The National Drug Helpline is also available. Its number is 1-800-633-6239. Again, 1-800-633-6239. Resources for crisis are available. Substance Abuse and Mental Health Service Administration is also available, and their number is 1-800-622-4357. Again, 1-800-622-4357. And they are also available 24/7 for treatment and support, and they are confidential. Also, Facebook support is available, such as the Facebook group Fighting to Survive, which is a support group. They're a dedicated team who also have mental illness. They provide confidentiality, and they are very welcoming. Also, another Facebook group is called Anxiety, Depression, and Mental Health Group. It's for people 18 and older that have mental health issues. They provide a safe place where you are not alone. For ADN News, I'm student nurse Charlene Robertson, and back to you.
Thanks, Charlene, for that report. Up next, it's flu season. Everything you need to know about flu versus COVID from our ADN team of Lakia, Alicia, and Cameron.
Breaking news from the Mississippi Delta Community College Associate's Degree Nursing Program. This news is being brought to you by Alicia Barnes, Cameron Hooker, and myself, Lakia Mormon. I'd like to discuss some information on COVID-19 and the influenza virus, also known as the flu. According to CDC.gov, the flu has been around since the spring of 1918, first seen in military personnel. And since then, we've been able to produce several vaccinations to prevent and limit its complications, as well as antiviral medications that help fight against the flu when it's in the body. The COVID-19 virus has been around since New Year's Eve of 2019, first seen in Wuhan, China. Since then, COVID-19 has been a repetitive topic across the world due to its rapid spread. No vaccines or antivirals have been produced to treat or fight this virus. The flu and COVID-19 are both contagious respiratory illnesses, but they are caused by different viruses. COVID-19 is caused by infection with a new coronavirus called SARS-CoV-2, and the flu is caused by infection with the influenza virus. Because some of the symptoms of the flu and COVID-19 are similar, it may be hard to tell the difference between them based on symptoms alone, and testing may be needed to help confirm a diagnosis. Both COVID-19 and the flu have a variety of symptoms ranging from a person experiencing no symptoms to severe symptoms. Similar symptoms may include a cough, shortness of breath, fatigue, muscle pain, body aches, or a runny nose. Some severe symptoms may include respiratory distress or even a loss of consciousness. There are some similar differences between the flu and COVID-19. COVID-19 seems to spread more easily than the flu and causes more serious illnesses in some people. It can also take longer before people show symptoms, and people can be contagious for longer. While COVID-19 and the flu virus are thought to spread in similar ways, COVID-19 is more contagious among certain populations and age groups than the flu. Also, COVID-19 has been observed to have more super spreading events than the flu, meaning that the virus spreads quickly and easily through people and is contagious much longer. Some key differences with with the flu is that a person typically develops symptoms anywhere from 1 to 4 days after infection. For COVID-19, a person can develop symptoms 5 to 14 days after being infected, but can appear as early as 2 days. The time ranges can vary. Most people with the flu are contagious for about a day before they start showing symptoms. Older children and adults appear to be most contagious during the initial 3 to 4 days of the illness and remain contagious for about 7 days. COVID-19 is still under investigation. It is said that a person can spread the virus for 2 days prior to even experiencing symptoms and remain contagious for up to 10 days after the symptoms appear. Both COVID-19 and flu can spread from person to person between people who are in close contact with one another, basically within 6 feet. Both are spread mainly by droplets when an infected person coughs, sneezes, or talks. These droplets can land in the mouth or nose of people who are nearby or possibly being held into the lungs. It may be possible that a person can get infected by physical contact, such as shaking hands or by touching a surface or object that has the virus on it, and then touching his or her own mouth, nose, or possibly even their eyes. While there is still so much to learn about COVID 19 and the virus that causes it, we urge you to continue to practice social distancing and stay safe. It frightens me to consider what a combination of these two viruses would look like. Thank you.
Great information, and thank you for that report. Up next, sexually transmitted infections, or STIs. Our ADN team of Heather, Katrina, and Alexis have some important information about education and prevention.
Common STIs. I'll start with chlamydia. It's one of the most common bacterial STIs, and women under 25 are at a higher risk of contracting it than any other age or population. It can cause abnormal discharge in men and women, painful urination and burning, swelling in one or both testicles for men, and rectal pain, discharge, and bleeding. Only about 10% of the population actually get symptoms of this STI, so it's very important that you get checked and treated if you suspect anything. It's transmitted by vaginal, oral, or anal sex. Treatment is usually about 7 days worth of antibiotics, and it's highly recommended that you go in for a 3-month retest to make sure you got rid of it and that you don't pass it along. Second on the list is gonorrhea. It has a lot of the same symptoms as chlamydia. It can cause the painful urination and burning, discharge, vaginal bleeding in between periods. It can cause rectal pain, itching, and soreness. It's also transmitted vaginally, anally, and orally. You get 2 antibiotic injections and usually a round of oral antibiotics. Genital herpes, there is no cure for this. You can only treat the symptoms, and during outbreaks, you can try to prevent those. You get flu-like symptoms, the fever, tired, fatigue, painful lesions and blisters, and drainage from those blisters. It's transmitted vaginally, anally, and orally, but also you can get it from kissing, sharing food, and drinks. The treatment is usually antiviral drugs, especially during the outbreaks. Acyclovir, famciclovir, and valacyclovir are the common antivirals for that. We're going to go to Katrina now for some more fun facts about STIs. Thank you.
Thank you, Nurse Heather. My name is Katrina Collins, and I'm a nursing student at Mississippi Delta Community College. And while we be giving you information on HIV, AIDS, and syphilis during the pandemic, there is currently no evidence that people living with HIV, AIDS at higher risk for being infected with the coronavirus, the virus that causes the COVID-19 illness. Our understanding of the risk of developing severe COVID-19 in people with people with HIV evolving. Current evidence suggests that HIV is less of a risk factor for severe COVID-19 than any other health disease condition, such as high blood pressure, heart disease, lung disease, cancer, diabetes, and being over a certain age. The best way to stay healthy for HIV patients is taking your antiviral medication for your treatment, wearing a mask, and sanitizing your hand either with soap and water or with sanitizer for at least 1 minute. As COVID-19 has rampaged across the United States, government officials have struggled with the basic steps needed to contain the pandemic. Should everyone get tested or just people with symptoms? Should the public health official require Americans to wear masks or not? There has to be a way to track these infections in our community. There are similar to arguments that officials or academics working to eradicate sexually transmitted diseases have been having for decades at their work to bring down the rates of infections like HIV, syphilis, gonorrhea, and chlamydia. Back to you, Nurse Alexia.
Hello, my name is Alexis Foster, and on today I will be reporting STI prevention. Okay, one prevention could be the use of a condom. You have female condoms, male condoms, and they come in all shapes, sizes, and brands. Another prevention could be limit your sexual partners. Okay, instead of having two, maybe decrease to one, because once you start having multiple sexual partners, that increase your risk for having STIs. Another prevention could be do not share any type of clothing, bathing towels, or anything with others, because those type of germs and different body fluids can mix together and you can, get an STI like that. Another prevention also would be do not share any type of needles or any invasive items that you have to use for yourself for others, because if that item have blood or any other type of bodily fluids and then you inject it into your arm or anywhere else, you could potentially get what they have. Okay, and the number one prevention that I have for you all today is abstinence. That is the only true way that we know that you can really prevent STIs. And my name is Elizabeth Foster, and reporting back to you.
Very important information, and thank you for that report. Up next in weather, winter is quickly approaching, and our ADN team of Keitha and Rusella have some cold weather precautions for the elderly and how to stay warm this winter.
Thank you, Hart. With winter approaching and temperature steadily decreasing, it's very important to use precaution to stay warm, especially if you're in the elderly population. Older adults are more prone to losing body heat faster than younger adults. Changes in your body that come with aging can make it harder for an elderly person to become aware that they are getting too cold. This can result in hypothermia or a very low body temperature. Being outside or in a very cold house could lead to hypothermia. Here are some tips for keeping warm while inside. Set your heat to at least 68 to 70 degrees. To save on heating bills, close off rooms that you're not using. Close the vents and shut the doors in these rooms. Place a roll towel in front of all doors to keep out drafts. Make sure your house isn't losing heat through windows. Keep your blinds and curtains closed. Dress warmly on cold days, even if you are staying in the house. Wear socks and slippers. When you go to sleep, wear long pajamas and use extra covers. Make sure you eat enough food that make up your weight. Body fat helps you stay warm. Ask family and friends to check on you during cold weather. If a power outage leaves you without heat, try to stay with a relative or friend. Space heaters are potentially fire hazards, so use the caution and don't leave them plugged up for extended amount of time unattended. Try to stay in on cold days, but if you have to go out, wear warm clothes and don't stay out too long. Here are some more tips for being outside in cold weather. Dress for the weather if you have to go out on chilly, cold, or damp days. Wear loose layers of clothing. The air between the layers helps to keep you warm. Put on a hat or scarf. You lose a lot of heat, body heat when your head and neck are uncovered. Wear a waterproof coat or jacket if it's snowy. Change your clothes right away if they get damp or wet. If you are having a hard time paying your heating bills, there are some resources that might help. Contact the National Energy Assistance Referral Service at 1-866-647-6327 or to get information about the Low Income Home Energy Assistance Program. For ADN News, this is Rose. Back to you, Hart.
Some great information for our elderly this winter. And finally, up next in sports, we have Jesse the Real Deal Villarreal with the story about common sports injuries and some tips on prevention and treatment.
Thanks, Hart. I will be talking to you about common sports injuries, acute treatments, long-term treatments, and prevention. Some common injuries including fractures of the extremities, concussions, sport sprains, and strains. Fractures of the extremities are treated case by case depending on their severity. If bleeding is noted, pressure to the site is necessary. Open wounds should be irrigated if dirty and wrapped to prevent further infection. Splinting is recommended to prevent further movement of the extremity. They may also require a additional rice treatment and possibly long-term physical therapy with maybe the use of a boot. Concussions can be best identified as an altered level of consciousness from trauma to the head. Signs and symptoms to look out for include headache, confusion, dizziness, nausea and vomiting, slurred speech, light sensitivity, and a delayed response to questions. An important thing to know about people suffering from concussions is that rest is a major priority. For those suffering from sprains and strains to the ligaments and or muscles or tendons, rice therapy is suggested. Resting and protecting the injured or sore area, ice to reduce swelling and pain. You can apply a bag of ice or cold pack for 10 to 20 minutes, 3 or more times a day, with 30-minute breaks in between. Compression or wrapping the injury or sore area with an elastic bandage. Make sure not to wrap too tight. And elevation. Elevate the injured or sore area on pillows while you are sitting or lying down. Try to keep it at or above the level of the heart, if possible. Emergency attention is needed in cases of difficulty breathing, dizziness, and fever. Best way to prevent injuries is to warm up properly and stretch. Make sure that you're healed before starting the activity or sport again, and make sure to cool down afterwards. Reporting live for ADN News, I'm Jesse Villarreal. Back to you.
Thanks so much, Jesse. And that's it for today. On behalf of our entire ADN team, thank you so much for watching, and here's to your health.